Imagine if you could take control of your health decades before you received a scary diagnosis like cancer or dementia. And we have found that making some informed choices can truly prevent some of the major diseases that occur later in life, including cancer and dementia and diabetes and rheumatoid arthritis and all different types of arthritis. And the earlier we find it, the better our health is going to be throughout our life. And we find that we can enjoy our lives and be more proactive when we make these choices. Because almost all diseases start in our body years before a medical diagnosis would occur. And they have, sometimes they say that a cancer is in our body for 5-10 years before we ever notice it. So we're going to talk about what we can do to be proactive and prevent a lot of these issues occurring later in life. Midlife is a perfect time to start making that transformation. And we're going to discuss today some real examples and real things that you can do, some actions that you can take. So get out your pen and paper and let's dive in. All right, we're going to start with diabetes. So diabetes is all about our blood sugar management, right? And when you go to the doctor, they're going to measure your HbA1c, especially when you hit midlife. They look at the HbA1c and it's going to reflect your blood glucose levels over the past 2 to 3 months. So it's kind of like an average. And what they have found is that if you can maintain your levels below 5.3, then you can significantly reduce the future incidence of developing diabetes. So prediabetes is not diagnosed until it's 5.7, and then diabetes is measured at 6.5 on that A1C. So you can see this is an early intervention that can save a lot of problems in your body. Because once you have diabetes, it's not just the sugar balance, it actually causes damage in your body. It can affect your vision, it can affect a lot of different things in terms of your digestion, a lot of problems that occur in association with diabetes. And it's not keeping your sugar balanced when you are diabetic. It leads to increased problems, other issues in your life, which we're going to go into in just a minute. The average carbohydrate intake for Americans is 250 grams per day. That's quite a bit, considering that it really is 90 to 100 is what the balance should be. And that's been associated with much improved blood sugar control and the prevention of diabetes. So that's an early intervention. Another thing you can do is increase your protein and healthy fats. So that means we want the protein intake to be around 90 grams or more per day, depending on your activity level. And incorporating healthy fats. So healthy fats like olive oil, we're talking about the monounsaturated, the avocado, and those kind of things can really help stabilize our blood sugar levels. And that might also include your omega-3 fatty acids. All right, that's an example of one area that we can truly be proactive in. It's also going to really help with weight management, especially women in midlife that are having difficulties losing weight. They find when they reduce their carbohydrates to below 90, the weight and increase their protein and healthy fats, the weight starts to come off. The stubborn weight that they've been trying years to go down, that I find that female patients do much better on that type of a diet. Okay, next one is dementia. All right, so there's a couple of different connections here that we're going to talk about. One is with blood sugar, which we just talked about with diabetes. It's also really connected to developing cognitive decline and also our hormone balance. So what they found, emerging research indicates that the chronic blood sugar imbalances do contribute to cognitive decline and increases the risk of dementia later in life. Also, significant hormone imbalances, including a significant decline in testosterone and or estrogen, are the major ones involved in cognitive issues. So what can we do? Dietary adjustments mean that we want to reduce our processed sugar and refined carbs, like we were talking about earlier, to below 90 to 100 per day. That's going to help improve optimal brain health and prevent dementias. And other nutrient support would include the omega-3 fatty acid intake. So that's like the fatty fish or supplements, all right? So you have your salmon, your tuna, and all of those kind of fish, and also taking supplements. Most people want to do it in a supplement form, and the recommended intake for this is 2,700 grams. Now with a hormone imbalance, rather than taking HRT or hormones, which can really be contraindicated, we want to do supplements that are called adaptogens, like ashwagandha and or maca. These are going to balance your own hormones naturally without causing an overload like giving hormones can. They're much better tolerated and metabolized in the body than hormones, which have to be given in certain dosages, and it's hard to manage what dosage your particular body needs. So why not do something where your body's doing the balancing itself? Okay, the third one we're going to talk about is joint pain. And this includes all kinds of arthritides like psoriatic arthritis, rheumatoid, just regular wear and tear, that often these worsen due to nutrient deficiencies and lifestyle factors that build up over a long period of time. So rather than wait to get a diagnosis, the doctor says, oh, you have arthritis, you can start, as soon as you start feeling that crickety feeling, or even before that, we're going to want to increase the omega-3 fatty acids like we did with the cognitive decline. They're going to have anti-inflammatory properties, and that's going to really help eliminate much of the joint pain and help with the mobility. So you can incorporate, like we were saying earlier, fatty fish, that's salmon, mackerel, sardines, and or increasing your intake through supplements. That's 2,700 milligrams of omega-3 fatty acids. And that really does make a huge difference in the health of your joints. So the other thing that we can do is increase our vitamin D levels. Now, vitamin D we know is essential for bone health, but it's also essential for our joints. And optimal levels, we're going to recommend 60 per milliliter. So when you get it measured on a blood test, you want it to be over 60 to 100. That's going to be the optimal level for your well-being, for anti-aging, for your joints, and many other functions. The last one I'm going to recommend is collagen. Collagen is really important. It's that cushy stuff in our joint that helps maintain its integrity, and it's really crucial for our joints. Dietary sources include things like bone broth, chicken skin, gelatin-rich foods. And you can also take that in supplement form. The hydrolyzed collagen supplements have been shown to really improve your joint symptoms, and many people take that as part of their morning smoothies, all right? It doesn't have any taste, so it's easy to incorporate really pretty much in anything. So in closing, there are just so many examples that I see in practice that have to do with hormone health and nutritional deficiencies, and that's why we need to be proactive in our choices early in life, in our midlife period, which I'm including maybe 50 to 70. And by understanding and addressing these early indicators, you're not only adding years to your life, but life to your years, right? That's what it's all about. So subscribe to our channel to continue your preventative anti-aging journey, and I look forward to seeing you on the next video.